Hi, everyone. Welcome to our Model Aquatic Health Call Network webinar. It is a pleasure to be here. My name is Daisy Galan. I'm a lead analyst at NACCHO, the National Association of County and City Health Officials, and I'm joined today with my colleague, Rebecca Rainey. We're going to be your moderators for today. And for today's webinar, we're going to be talking about using environmental health data to inform pool regulatory efforts in the city of Long Beach, California. Before we get started and we introduce our speaker of today, I just want to go through some of our logistics for today's webinar. This webinar is being recorded, and all registrants will receive a follow-up email with a link to the recording, as well as the slides for today's presentation. Also, we encourage you to ask questions throughout the webinar, so please use our Q&A box. You can find the Q&A box at the bottom of your screen. You can submit questions throughout the webinar. We're going to have plenty of time to go through, and we plan to go through as many questions as we can at the end of the webinar. Due to the volume of participants, we're not able to allow verbal questions, but you're welcome to add anything to our Q&A box. So with that, I will go through today's agenda. We're going to start with some quick updates from NACCHO and our CDC partner. Then we'll turn over to our colleague from the city of Long Beach for today's presentation. And as I mentioned, we're going to have time at the end for questions and answers. So with that, I'm going to turn it over to my colleague, Rebecca, to go through some of our announcements for today.
Thank you, Daisy. So before we jump into today's presentation, some NACCHO announcements. If you're interested in exploring any of our past MAC network webinars, you can view all of our recent webinars, their slides, and any supporting materials at our website, which is naccho.org/MAC. And if you want to dive into all 35 of our webinars going back to 2016, we have all of them housed on a YouTube playlist, which is linked here. As a reminder, we will send out the slides with these links after today. And we wanted to also highlight some MAC-related resources that have been released recently. So NACCHO partnered last year with the Pueblo Department of Public Health and Environment to capture their experience fully adopting and implementing the Model Aquatic Health Code into their local code. And from that, we have a publication that will be forthcoming in the next couple months. But we wanted to highlight one resource that we already have published, which is the resource library. So this resource library contains various resources developed and shared by Pueblo County that they use during their adoption and implementation process. So this includes inspection reports, forms, the draft code, presentations and newsletters, and more. It's a great wealth of resources. So to access this resource library, you're going to visit the NACCHO toolbox at this link. You will need to either log in or create a free My NACCHO account to download, and you can download it as a zip file. And then lastly, NACCHO released 2 Model Aquatic Health Code quick guides recently. These quick guides are on splash pads and flotation tanks, 2 topics covered in the MAC. And these 2 to 3 page reference guides on each of these subjects can be used by local health departments and pool operators as great tools for understanding CDC's key recommendations for the operation and maintenance of splash pads and flotation tanks. So if you're interested in exploring these resources, which combine information from CDC's 2023 edition of the Model Aquatic Health Code and their website, you can click on this link to view and download. With that, I am going to pass it to our CDC partner, Commander Joe Lako, who's going to share some CDC announcements.
Good afternoon, everybody. Thanks for joining us today on one of our MAC Network webinars. I wanted to give everybody an update on where we are for the 5th edition MAC update. This past fall, we opened, or this past spring, we opened up the CR, the change request process, and we closed that this past fall. And we recently had, last week, in conjunction with the AOAP conference, the Association of Aquatic Professionals Conference, we had the Vote on the Code conference that was hosted by CMAC, Council for the Model Aquatic Health Code. And we had an opportunity to meet in person and collectively with the membership of the CMAC. And we discussed every CR that was submitted. Most of our time was spent on the more complex ones or controversial ones, or the ones that people may see as more problematic. We were able to also break into caucuses and talk individually per sector. So I spent some time in the public health sector, and we discussed some of those CRs that, if included in the next edition of the MAC, may have an impact on public health. So the next steps are CMAC member voting on potential change requests. That'll be happening on March 1st through the end of the month. So you have a full month to vote on change requests for inclusion into the 5th edition Model Aquatic Health Code. Then after that, it's going to be up to CMAC and a couple folks here at CDC, like myself, to get those approved changes incorporated into a new document. And then, unfortunately, have to go through the CDC clearance process, which is very long and arduous, but it helps ensure that we're going to have a really tight document at the end. That usually does take a few months. So with our fingers crossed, we'll have a 5th edition available maybe by the end of the calendar year. But once it gets cleared through CDC and has to go through 508 compliant and posted to the website, I'd like to think that we could be able to do all that within the next year. So maybe early 25, with any luck, towards the end of 24. And that's all I had, Rebecca. I'm going to turn it back over to you so you can introduce our speakers.
Thanks, Joe. Yes, so it is my pleasure to introduce today's speaker, Robert Campbell. So Robert Campbell, consultant at RS Campbell Consulting Incorporated, is a longtime partner of the City of Long Beach's Department of Health and Human Services Bureau of Environmental Health. He currently administers their data management system, provides grant writing and management, and manages other projects. So Robert's going to talk today a bit about how the City of Long Beach is using their environmental health data to inform their pool regulatory efforts. And just as a reminder, if you have any questions for Robert, feel free to submit them in the Q&A box and we'll get to them at the end. So I'll give you a chance, Robert, to share your screen and we'll get started. Thanks, everyone.
Okay, I'm going to give the screen a moment to come up for everybody, but I think it's sharing now. So I'd like to introduce myself. My name is Robert Campbell. I'm a consultant with the City of Long Beach Health Department. And I just I'm thankful for all of you who have joined in this presentation. It looks like there's at least 170 people watching. That's great. I really look forward to giving you some more information about our grant program with the CDC. Unfortunately, my colleague Juan Garcia is unable to join us today. He's been a very key part of our grant program, but something came up and he just couldn't join with us today. So I'll give the entire presentation. You'll have to listen to me the whole time. I'll do my best, and we'll just get going here. This presentation focuses on a grant program that we were awarded from the Centers for Disease Control and Prevention. One of our major activities within this grant program was to conduct an educational and training intervention for lower compliance public pools and spas, which we regulate. And this presentation will cover, among other things, how we used our environmental health data to help us make decisions, including determining lower compliance pools, and the results of the intervention activity, which we're evaluating right now, but we have quite a bit of preliminary data we can share with you. I'm going to go to the next slide. I'd like to give a little background on the City of Long Beach, and then our health department, our Environmental Health Bureau, our water quality program, and then the grant program we'll get right into. So you have some good background about us. So we're the City of Long Beach, California. We're located in southeastern Los Angeles County and right along the Pacific Ocean. Excuse me, get a little drink here. We're home to a diverse population of nearly 470,000 people as of the 2020 census data. We're an import and export hub via the massive Long Beach, LA port complex. It's, I think, the third largest port complex in the world when you combine them, and they're right next door to each other. You might as well call it one giant port complex. Lots of goods movement going through Long Beach and LA. One thing about Long Beach, I lived there for over 20 years. I live south of there now, but there's a lot of established residential neighborhoods and commercial corridors. And there's a lot of like a neighborhood feeling. I think we used to be known, and maybe still we're known as the Iowa by the Sea, just for mainly for that aspect of the old residential neighborhood areas. Some of the industrial activity is centered around aerospace and goods movement. We also have a large airport in the city. And so there's a lot of industrial activity revolving around goods movement and aerospace. It's a very tourist friendly city, a lot of special events, conventions, and we're kind of like in the center point of Southern California in terms of, we're pretty close to Disneyland, downtown LA, a lot of the major beaches like, that people might want to visit, like Santa Monica or Malibu, Newport Beach, Huntington Beach. They're all within, half an hour to an hour, depending on traffic that day. But it's a great launching point for, vacations for people coming to Southern California. There are 7 miles of coastline. So we have quite a bit of coastline, Pacific Ocean coastline, and also our harbor. Lots of recreational water. And we're bordered by 2 major rivers, which have been maybe in the news, even nationally, in the last few weeks. We've had a lot of heavy rain. And in Long Beach, on our west side, is the LA River, and it outputs into the kind of into the LA Long Beach harbor and port areas. And then on the eastern, kind of southern Long Beach border is the San Gabriel River. And both of these are seasonal rivers. I think they run throughout the year, but seasonally, they really mostly run in the winter time. And they can have some flooding. And, we have millions of people upstream and businesses and everything else you can imagine that kind of dump into Long Beach. So we do have a lot of, we have a very active water quality program we'll get into in a moment here and tell you a little more about that. The one final thing I'd like to mention is in 2028, the Olympics will be coming to Los Angeles, and the city of Long Beach will likely be, very involved in that. We have a swim complex that may be used for training or possibly even events. I think in the 80s or 1980, maybe we had or 84, we had the Olympics here. And I think they did also some yachting outside of Long Beach. So it'll be really interesting as we push forward to 2028, how we'll be involved in that and how our environmental health staff will be impacted by that. The Department of Health and Human Services is it's one of 3 city-run health departments in California. Most of the health jurisdictions are county jurisdictions. I like to say that Long Beach might as well be a county with the number of people and the diverse things and peoples we have here, but we are a city, and some of the major goals of the health department are to promote and create a self and healthy community to live, work, and play, to be data informed, to establish priorities, inform practices, and focus resources. And then you'll see that that's kind of a theme of this grant program. And you'll see that throughout the presentation that, we're trying to use our data more to help us make decisions and focus our resources. The health department also provides services that address adverse health conditions and events, and utilizes an equity lens to assess, prioritize, and implement services. Focusing down a little further, the Environmental Health Bureau, which I support, and Keith, who's on the call, is a supervisor in the water quality program. And this is where we have been administering this grant program that we're talking about today. But just kind of a general overview of environmental health and what we do. Environmental Health Bureau protects the public health by preventing diseases, unsanitary conditions, exposure to toxic substances, and by eliminating environmental hazards. So on the left here, you'll see one of our vector control staff sampling some water for mosquito larvae. And so we have a very active mosquito surveillance and abatement program as part of our vector control program. And on the right-hand side, you'll see this is one of our environmental health specialists in our food safety program. So we have a very active, of course, food safety program where we inspect restaurants and other businesses that provide food to the public. We also have a water quality program, which I'll detail more in the next slide, a hazmat and hazardous waste program, and various grant programs and other smaller programs. But pretty much anything that is involving environmental health, where we have a hand in that. So the recreational water quality program, the goal of the program is to perform regular inspections and provide services to ensure water quality and safety requirements are met and the public is safe from environmental hazards. So the couple of images we have here, the one on the left, that's Long Beach State University. And this is one of they have quite a few pools there, but this is their like major pools for events. They have water polo teams that compete here, and they do swim meets and things like that. So this is a good example of one of the pools that we oversee and regulate. I'd like to point out in the background there is the pyramid. If anyone's heard of that, that's our famous Long Beach State Pyramid, where the basketball and volleyball teams play, and they do a lot of other events and things like that there. It's been there since the mid-1990s, and it's kind of an icon in the city of Long Beach. Over on the right-hand side is an image showing a sign that we will post if recreational waters are, if bacterial counts are too high for swimming. So, this time of year is typically when that happens. It'll happen in the summer as well, but we get a lot of our rains in the winter time, and that can cause a lot of outflow from the different rivers, and just even local outflow that can increase bacterial counts. So, it's an active program that we run as well in our water quality program. Also, of course, inspecting public pools and spas is something we do regularly, and we conduct plan checks. We also oversee in the water quality program internal backflow devices. We ensure annual tests are conducted. We conduct surveys, and we also approve plan checks and review and approve plan checks. We also have a fog program. We're not inspecting the fog, but what that stands for is fats, oils, and greases. And we inspect. I think we're getting some feedback. That's better. Great. And the fog program inspects facilities that create any kind of grease waste. So it's typically like your restaurants that are preparing food, frying foods, things like that. So they have to dispose of their grease waste in the proper manner, or else what happens is if we didn't have this program, we didn't make sure that they were doing that, we would have a lot of clogged sewer lines. So that's actually a really important program. So that's the recreational water quality program. And now getting down to really what the goal of the presentation is here today. Within the water quality program, we've been administering this Long Beach Environmental Health Data Capacity Program, which utilizes our environmental health data to make more informed decisions to identify and address environmental health hazards at public pools and spas in Long Beach. It's kind of a side note. There's another component to the grant but it's very similar, and we're looking at restaurants and in improving the compliance at lower compliance restaurants. But we're going to focus obviously on public pools and spas aspect because that's what this group is interested in. So this is a little background on the grant program and how we have kind of built it up to where we're at today. It's a 5-year grant program because there is an evaluation component included. We're in year 4 right now. It was awarded to us, I don't have the exact date, but it was in 2020, I believe. It was during the pandemic. So that was really interesting to try and implement the program. It caused some issues, but we were able to certainly to get that going. But we're very thankful it's 5 years. We had some slack time in there to catch up. One of the main things we did initially was to identify a priority area. So we looked at census tracts in the city of Long Beach that the residents were more at risk of environmental hazards. And we identified 10 census tracts where that seemed to certainly be the case. And we wanted to conduct this intervention at those lower compliance pools in that area as kind of a, we're looking at areas that could use these services the most. But, possibly someday we could provide similar services in other census tracts in the city. But this is what we focused on. The next step was we needed to develop a compliance rating system. And we'll get into that a little bit on some upcoming slides, how we did that in our data system. The next step is, once we've developed that, is to conduct our baseline inspections. And really, this is just our annual routine inspections that we provide at all of our pools and spas in the city of Long Beach. We have about just a little over 500 public pools and spas in the city that we regulate. And in this priority area, there are 69 public pools and spas. So it's a little more than 10% of our total inventory. So we would conduct our baseline routine inspection and calculate the compliance rates. And from that, we could identify some of the lower compliance pools that we would like to approach and the operator of the pool and see if they would be interested in enrolling in our intervention program. Once we enrolled those pools, and we ended up enrolling 10 pools in the program into the intervention, we would provide the intervention, and we'll get into more details. That's a really important part of what we're presenting today. So I'll save that for the future slide. And then once we've conducted the intervention, then afterwards we'd conduct another routine inspection. We would call that the post-intervention inspection, and calculate compliance rates. Obviously, we're looking at, did they hopefully increase or did they change in any way? And what do we understand from that? So that's comparing the pre and post test compliance rates. And then the stage we're at right now is evaluating and reporting the results. So we're well into that. We have some preliminary data to share with you later. And we're not, finished with that part of it yet, but in about 6 months we should be. And we look forward to, evaluating the program in total. So we talked a little bit about the intervention on the previous slide. So this is more details about the educational and training intervention. As I said before, we enrolled 10 pools and spas into the voluntary intervention. And it was, of course, based on compliance rates. Did they have lower compliance rates? Were the operators willing to participate? That was important. And we didn't want to enroll pools with plan check issues because of the timing. Plan check can take quite a bit of time if they're needing to do that to correct any violations. We ended up enrolling 2 pools that had some minor plan check because the operators really wanted to be involved with the program. So we did enroll a couple of the 10 were had some plan check issues. What we did for the intervention is to provide a self-inspection checklist to the pool and spa operators that they could use themselves or share with their maintenance staff. to use during regular maintenance. And this was more of to gain familiarity with what we do as regulators. It approximated our own inspection checklist. So on the right-hand side, you can see kind of a part of that. And this is the self-inspection checklist. And as you can see, there's a little arrow pointing to a web address where you can get the full PDF version. Now it's a very long web address. If you want to copy it down now, go for it. But we are going to copy and paste that to the chat at the end of the meeting. And also we'll be making our slide deck available for participants. So you could also get that address there. And we'll also be giving my email address and Juan's email address if you had any questions about the program or anything. And we could also send you the self-inspection checklist. It's one page front and back. So it's something pretty simple to be able to give out to individuals if they're interested in learning more about, in our case, what we do for our regulation of public pools and spas. The goal, though, with those that were enrolled in the program in the intervention group was that they would gain a much more familiarity with what it is we're doing, and they could utilize this checklist when they did their their regular maintenance. The pool operators could keep an eye on things, and of course their maintenance staff could use the checklist and maybe even provide a more comprehensive regular maintenance. That would be the hope of utilizing this. We also Juan, I've talked to him a lot about just some of the details of his experiences working with the pool operators, especially the ones in the intervention. And he did give a lot of consultations and advice. There were a lot of questions asked. He checked in with them periodically, and so they developed some good rapport, which we'll talk about later. As one of the side benefits of this program for us. Of course, the next routine inspection after they had been utilizing this self-inspection checklist for a while would hopefully show some increased compliance. So the compliance rating system, I want to get into that a little bit, how we developed that out. We didn't have anything like this previously, so we had to develop it. We have a data management system we've been using for over 10 years. It's a legacy system. If you're not familiar with that term, just essentially means it's old and not really being updated or upgraded anymore. We are currently in the process of upgrading our data system. I mean, the one we use currently, it's pretty good. It's just it won't be upgraded anymore, so we need to move to something new. But in this data system, what we were able to do was for all of the potential violations that we might cite out in the field when we're doing an inspection, we were able to assign a point value to them. Point deduction value is what we called it. So Juan and Keith, they looked at all of the different violations, and if they were considered a lower risk violation, they gave it a 1 to 3 point deduction value. A medium risk violation, 4 to 6 point deduction, and a higher risk violation, 7 to 9 point deduction value. So I'm going to get into the next slides here that will show this really corresponds to actually our checklist. It doesn't really look like our checklist exactly, but it's in the order of the violations on the checklist. So I had to split it up into 3 slides because we have quite a few items that we review when we inspect the pools and spas in our jurisdiction. So what you can see here is 3 different colors of the different violations. So if it's in red, it's a higher risk violation. If it's in if it's in green, it's a medium risk violation, and blue are the lower risk violations. So as you can see, kind of in our own checklist, a lot of the higher risk violations are at the beginning of our checklist. It's broken out by major areas: pool enclosure, safety equipment, pool chemistry and sanitation. And you can see, especially in like pool chemistry and sanitation, a lot of those are some of our very higher risk, most highest risk violations. There are a few medium risk violations and even one lower risk one on this first page here. And then when we move to the second slide and moving down our checklist to recirculation and associated equipment, still quite a few high risk violations there, but we're starting to get a smattering of medium and lower risk ones. And then as we move into pool structure, pretty much most of them are we're given the point value of 5 of being pretty medium risk, average risk, I guess. And then towards this is the end of our own checklist. We have all the signage requirements. Those are all pretty low risk, a few medium risk ones, and then some miscellaneous ones that just didn't fit in any of the categories there. We have one high risk violation for pool temperature, and then some lower and medium risk violations as well. So this is now, I'll get into some of our actual results that we've encountered conducting this program. So what this slide will show you is for the priority area. There's 69 pools. Within that priority area, the intervention group, there's are 10 of those pools, and the control group is the other 59 pools. So of course, the intervention group were the pools that received the intervention, and the control group are the ones that did not receive an intervention. And so this is a big part of our evaluation is analyzing, assessing, what happened with compliance rates between the intervention group and the control group. But starting just with the total area, we used inspections, the annual inspections that we conducted in 2021 and 2022 as our baseline inspections, as what we would look at to help us determine some of the lower compliance pools that we'd like to enroll in the intervention. As a group in the priority area, in 2021, the average compliance rate was 95.34%. Now that sounds really high, but we have to just look at these as comparisons to other compliance rate. And it's partly to do with the scoring mechanisms, and we might play with that later on, so that some of these values show a little bit more of a difference on their, kind of like on the face value of it. But this is actually a pretty good compliance rate when it boils down to it. But there were some, this would be on average 3 or 4 maybe violations per inspection. We did have in 2021 in the priority area, one pool was as low as 88%, and we had a number of them that had perfect scores. In our intervention group, the ones that we ended up enrolling in the group and providing the intervention, the average compliance rate was a little bit lower, and there was a range of compliance rates from about 88% to, we even had one that was, I believe, we had to enroll right at the end. Another pool had backed out, so we enrolled this one because in 2022 it had a lower rate as well, and the operator really wanted to be in the program, so we're like, okay, we'll put you in there and see what happens. And then in our control group, the remaining 59 pools, the average was about the same as the priority area in total, 95.5%. There was the one pool that had this lower rate, and a number of pools had a perfect score. So in 2022, we didn't do anything different, just provided our regular annual routine inspection. And this is where things maybe start getting a little interesting. So we noticed that the average compliance rate reduced a bit, but I think that would probably be mostly just due to variability. It's never going to be exactly the same. We'll go look at previous years. We have data all the way back to 2016 that we can use, and we'll just see how over time these numbers, these average compliance rates went. But just interesting to note there was a 0.5% or more decrease in 2022 for the whole area. Even more interesting was our range of rates increased. So we did have a low score of 78.31%. And of course, we still had some pools receiving 100%. So for the intervention group, very interestingly, the average compliance rate went up about 2% in 2022. And that was before we even provided the intervention. I need to discuss this more with Juan and see if he has any input on that. But I think part of what this might be is I know because this was such a long period that we were conducting these activities, that he was working closely with some of these operators already because they had lower compliance. So that could be partially why they increased noticeably in year 2 when we hadn't even conducted the intervention yet, because possibly we were already doing some of those things. So we need to look, that's some of the details we need to look into a little more. We did have in the 10 pool intervention group a low score of 78.31%. So one of our pools in the group was very low scoring, and no one scored 100%. So that was interesting as well. The highest score was just under 99%, which is probably one violation. In the control group, the average also went down a little bit, and the range was a little bit higher, not by much. So the real interesting column here is 2023. This is after we conducted the intervention. So in the pool priority area, we did notice again another slight drop in compliance. Again, that could be just due to variability, but it's interesting that it went down for those 3 years, or the next 2 years, or slightly. We did also, the range increased again. We did have one pool that the lowest score was 74.24%, and of course still had some pools getting a perfect score. So the range did increase. So in the intervention group, we also noted average compliance increased a little bit after the intervention. So that was a good sign that even after that big second year increase on average, we still had an increase with the intervention. What I think is even more telling is that our range of rates reduced dramatically. The lowest scoring pool was near 94%. And we'll go over each of the pools and spas and in a similar fashion in one of the upcoming slides. And we even had some of the pools get a 100%. So this decrease in the range can kind of tell us that our intervention standardized our compliance rates in this group. I think that's a fair assessment of that. In the control group, the average compliance rate actually, it reduced quite another almost percent, and the range increased quite a bit. Excuse me. So this slide here, what this chart here shows us is just the 10 pools that were in the intervention. Actually, it's 8 pools and 2 spas. And this shows our baseline compliance rate in 2021. So you notice there's a lot of lower compliance pools in here, a few that are higher, like this one I talked about earlier that we had to enroll at the last minute. But there's some lower scores in here as well. There were others that also had even lower scores than these, maybe around 90%, let's say, but they had excessive plan checks, or the operators just weren't willing to be, they just didn't want to be involved. So, we couldn't just pick who we wanted to, because this was a voluntary program, but we did have quite a few lower compliance pools actually from 2021. What you'll see in the columns for 2022 and 2023 is if the number is in bold, if the percent is in bold, it's increased from the prior year. If it's red, it decreased. So this was kind of interesting. A smattering of the pools, or more than half, 6 of the 10 pools increased their compliance from baseline year 1 to baseline year 2, but we saw some pretty dramatic decreases as well. In 2023, though, we noticed quite a few really high scores, but also some decreased scores. So that's another interesting thing we need to look at. I point out pool number 3, when after the intervention, it decreased about 2.5%, and pool number 6 also decreased maybe by 3.5 or actually about 4.5%. There also were a couple pools that showed some major increases, pool 2, spa 2, and a few of the other ones. So these are the ones we want to look into a little more in depth. And what this might help us with is to fine tune our intervention if we were to use it at all in the future. And there are some plans for that, some ideas about that. We do have some issues with our staff capacity, but this might be used with very low compliance pools that have a lot of recurring violations, things like that. This might be a way to help them increase their compliance. And that's a lot of what this grant program is looking at, to have those kind of tools available. This chart here just shows each pool and year by year their compliance rate. So you generally notice an upward trend, but you do notice some downwards in a few cases as well. And just another chart to look at this in terms of a higher level view. You've got your in green the line for the priority area for the 3 years. And you notice the priority area as a whole, 69 pools on average, the compliance kind of just went down. The scale is just from 93 to 97%. So kind of show the differences better. The intervention group is in the light blue. And of course, oh wait, let me go. The control group first is in the orange. It also had a decrease similar to the priority area. But you notice the intervention group had that uptick, and then quite a bigger one in 2023. So for the intervention group, some of the things we've already noticed is, the compliance rates have since from 2022 to 2023 have gone up about 2.8%, and compared to the control group, about 2.9%. One thing I think is interesting is the range of rates. So in 2021, that range was from about 89 to 100%. And if you calculate the standard deviation, it was about 2.9%. And I'm not a statistics wizard, but my limited understanding of standard deviation, I think it's a good calculation for this type of a study, because what it shows is the variation of results around the mean or average score. So using our first year of baseline inspections, it was about 3%. I'd say it's maybe not high or low. In 2022, though, it increased quite a bit, the variability, up to this standard deviation of 6.5%. So showing there was just a lot of varied results. They weren't clustering around the average. What's really interesting in the intervention group is you notice that the standard deviation decreased dramatically. So it showed that the results were starting to cluster around the average, meaning we're getting some standards out of our intervention. So that's a really good sign that even though some of the scores went down, they're all clustered around this kind of standard average value. And then we'll go to the whole, the control group, the same kind of investigation. The control group, their compliance rates from 2022 to 2023, it went down a slight amount. And that's just variability. We're not doing anything different really here in the control group. And compared to the intervention group, of course, it was about 3% less. A similar look at the standard deviation of the results in 2021, it was of course it was the same exactly as the intervention group. It went up a bit in 2022 for the control group, but it's continuing to go up in 2023. Again, this could just be variability, but it could also mean that it's something we can look at, that we're not achieving standards maybe as much as we would like. There would be a lot of other review that would go into something like that, but these are just interesting to note compared to the intervention group. So we still have a little bit of time, so I'm going to quickly go through the next few slides and finish up here for some Q&A. Based on those major categories of our violations, this is another area we want to look at. And for all our inspections conducted since 2016 through the end of 2023, for the citywide, for all of our pools, this has been the #1 area we've cited violations: pool chemistry and sanitation. Signage was up there as well. And for our priority area, it tends to focus around recirculation and associated equipment, pool chemistry and sanitation, and signage is up there as well. So there's some similarities, but certainly some differences in the two areas. On this next slide, I think it's a little more interesting, is the actual violations themselves, not just the groups. And I color coded them again to show the lower risk violations in blue, the medium ones in green, and the higher risk ones in red. And citywide, and in our priority area, the violation we cite the most is provide and repair the flow meter. So that's actually a good data point to realize, oh, wow, that's something we're citing quite a bit. Maybe we can adjust what we do to help out with that. But as you can see, mostly it's these lower and medium risk violations that are most frequently cited. I guess that's good. We feel good about that. Some of these, though, there's like over 50 total violations that we could cite, and this is just a snapshot of the highest, most cited ones. So there are some higher risk ones showing up here. And I won't go into too much details about these, but these are ones that we might then want to focus a little more on in our inspections. It's something that will help us determine these kind of things using our data. This slide just kind of goes over some of the things you can do with your data. You could identify a compliance rate, maybe a minimum compliance rate that would result in some sort of an intervention. That's in a nutshell what we're testing here. You could look at your most frequently cited and higher risk violations to help you focus your resources better. Another thing that we're starting to do, and we might look at trends, is we could examine trends based on things like the location of the pool. Is it an indoor pool versus an outdoor pool? What's the ownership type? Is it a corporately owned pool, or is it just an individual owner? Is it an HOA? Something like that. Is it a pool at a public park? There's different things we can look at in terms of location and start looking at trends and seeing if we could focus on certain things in that regards. So that's that slide. Oh, this is just some of the challenges, successes, and lessons learned from the program to date, at least. So some of the main challenges for us as a regulator, getting voluntary enrollment was kind of difficult. At first, the pool operators, they just really weren't willing. Juan had to many times talk to them, and their initial concern was that they were going to receive more inspections and have more violations to correct. And we made it clear with them that no, we're just conducting our normal, regular annual routine inspection, and of course there's violations that we will need you to correct, but that we're just going to help you kind of not only get those corrected, but maintain your pool in a way, hopefully in the future, by giving you some training that will be more compliant. So once one was able to describe it in that way, quite a few of the owners were like, oh yeah, we'd love to do this. So it's just a matter of communication. One thing, of course, early on we did figure out was a challenge was plan checks, and that could really delay a study such as this. So we had to, unfortunately, some of our lower compliance pools, our lowest compliance pools, we just couldn't enroll them because they had excessive kind of plan check requirements, and it just was going to make it real tricky to be enrolled in the program. So there's always these like variables you have to look at and think ahead that might cause problems. Also, we noticed there were changes in pool maintenance providers. So a lot of our, in fact, I think all of the pool operators in the intervention had vendors, doing the maintenance. And in a couple cases, their maintenance provider changed. So that was something we would have to take into consideration in our evaluation of results. Some of the key successes, we were really pleased at the rapport that was built with the operators that we were working with. Some of them were already ones that Juan had some good relationships with. He's been doing this pool inspections in his area for a number of years and has developed some good relationships, but they were even enhanced beyond that. And so we see them as partners now, and that's really great to have that kind of a relationship. We certainly hope the pool operator and their maintenance provider, their knowledge and abilities have been enhanced. We're not testing that per se. We might have some qualitative, points on that, but we do feel that has occurred, and we hope, it's something that they can certainly maintain and take with them. Another key aspect of success was, we really were able to enhance our current aging data system for capabilities that we needed for this grant program. But it also did highlight that we need a new data system so that we have even more and more modern capabilities. Some of the lessons learned is just, persistent communication, fostered a partnership with our pool operators in the intervention program. Certainly, if your data system that you're using is really stretched to its limits, start considering a new data system. I've been around this process for a long time, and right now I'd say at least every 10 years you need to be looking at upgrading your data system. Sometimes your current data system provider is doing a major upgrade, and that's great. And then they'll just upgrade you to their newest system. But sometimes you have to look outside. We had to do that. We did an RFP and all of those kind of things. If anyone's interested in those details, you can certainly email me and we'll start a conversation on that. And then definitely that partnerships can enhance your objectives and your data points. This next slide will go through that a little more. One partnership that we really like to focus on that came up during this early parts of the grant program was with our fire department in the city of Long Beach. They respond, of course, to 9/11 calls and emergencies, and they're now when there's a drowning or near drowning incident, they have us respond to that public pool or spa as well. And so that has become a good partnership to kind of close the loop there and be more comprehensive in our response to these kind of incidents. We also feel we have some of the, these pool operators that we were working with in the intervention are now our partners. And so that can be very helpful as well. A couple other partnerships, with this grant program, the CDC has been great, with just advice on designing our evaluation and we were having some trouble enrolling in our intervention. They had some good advice for that, and just kind of helping us through some of the steps of this program. So if you're fortunate enough to receive a grant funding for something like this, really work with your funding agency. They've got a lot of experience, and they have contacts with a lot of other regulators that might be able to help you through something tricky. And if you're looking to upgrade your data system or utilize it to its full extent, we have what's called the Technology and Innovation Department. A lot of times it's just your IT department or your IT staff, but lean on them as well, get their expertise, because there's so much going on in technology these days that we all need help in terms of in utilizing what we have or improving it. So that's essentially the presentation. I know we don't have a lot of time left for questions, but I'm going to open it up for those now, and I'll turn it over to the moderators.
Hello, thank you so much, Robert, for the great presentation, and it's really interesting, and we look forward to continue staying up to date and hearing more. So we have about 5 minutes. There were some questions submitted in a Q&A box. We wanted to encourage everyone, submit your question. If we're not able to get back to you here live, we will record your question and we'll submit a Q&A summary document with all the questions with the webinar materials. So Robert, one of the questions here to get us started, it's regarding the COVID-19 pandemic. So regarding change to compliance rate results, do you think COVID played a role in the results that you saw in 2021 and 2022?
Yeah, I think there is something there. We haven't really dug into that yet, but that certainly was such a major event that, when we really dig into our evaluation of our results and how we were able to apply those early steps of the program, we're going to include that. Timing, there was, I think there was there was roughly a 1-year period where everything we were doing in environmental health was different because of the pandemic. And then it really adjusted after probably that first year, where we just had a few things we were still dealing with. And then we got right back into pretty much what our normal ways we handle things. But yeah, definitely we're going to look at that. And I wouldn't be surprised if there were some differences due to the COVID pandemic.
Thank you. So we have a couple questions that were answered over the chat, but we wanted to give an opportunity to answer them live as well. So these questions were if staff turnover or pool operator turnover was a factor in compliance, and similarly, if the same inspector was doing inspections each year.
So yeah, the Juan, who couldn't make the presentation today, he was the consistent, inspector for all of these pools. So that was really good that we had that consistency. So we didn't really have any issues with staff turnover for the person who was providing that. In our water quality program, we had a couple of vacancies here and there. So that also was a bit of a challenge, especially around the pandemic. Just trying to get capacity for doing this kind of program. And then there was one other part to that question.
Oh yeah, so it was if staff turnover or pool operator turnover was a factor in compliance.
Oh yeah. Yeah, we didn't have any pool operator turnover. I think for all 10 pools, it was the same operator, but it was their maintenance staff. We had a couple situations where the vendor, turned over. So yeah.
Great. I think we have time for maybe one or two more. So, Robert, do you know how much staff time was dedicated to this program? At least an average. Do you know how much staff time was used to implement this program?
Yeah, and we're actually going to be providing a more detailed analysis of that when we report to the CDC for our evaluation and our best practices for this program. So I've already actually started doing that, and although I can't really quote a good rate right now, that will definitely be coming out. One thing I will mention is running this grant program. There are a whole lot of other considerations that if you were just going to do this as a regulator without having a grant program, you're just doing it on your own, it'll be a lot less staff time. So when you have a grant, especially with an evaluation, and there's a lot of planning that goes into it and a lot of time that goes into that. But especially because we've done a lot of the legwork, and if we can provide like a baseline kind of outline, which we will be doing, that will help any other jurisdiction and greatly reduce the staff time. But you'll have some, there's some time. You'll have to have some excess staff capacity to do something like this.
Right, and we can probably squeeze in one more quick question, and then we'll make note of the rest of the questions, and Robert can help us answer those, and we'll send those out to the rest of or after this webinar. So we had someone ask what a plan check is. It was referred to a lot as being a reason to not be included in the intervention program.
I'm going to actually give this one over to Keith if he's available. He could quickly maybe what our plan check process is and why that was a problem for this grant program to enroll into the intervention.
Yeah, sure. I did answer that one typing because I saw we were getting close to the wire. So I tried to answer as many as I could before we got to the Q&A. But just in general, plan check is anytime anyone's doing construction of a public pool, whether it's new construction or remodel. So on an existing pool. So these are existing pools. It'd be a remodel, and that process is lengthy from the time they submit the drawings, architectural drawings. We review them to ensure that everything that they're doing meets code. To the time it's constructed and built, it could be several months. So that's why they were excluded out of this project scope.
Great. Well, thank you, Keith. And of course, thank you, Robert, so much for your presentation. We are right past 2 p.m. here in the East Coast. So we're going to be thoughtful of everyone's time. So we will have to end this webinar. But as Rebecca mentioned, we took notes of the questions that were submitted here. We'll follow up with Robert and Keith. We'll put together a summary of the questions, and you receive that with the webinar materials. Again, thank you to our speakers. Thank you for this great work. We can't wait to get to know more as you continue this program forward and continue analyzing the data. And you will stay in touch. For everyone else, we thank you all for attending today's webinar. As a reminder, you're going to receive the recording, you're going to receive a copy of the slides, and we look forward to seeing you here in our next webinar, series. Thank you so much. Have a good rest of your day and week. And this concludes today's webinar.
Bye, everyone. Thanks.